We are Accelerated Medical Diagnostics.
Hi, I'm George Semino.
Hi, I'm Bill Hope.
I'm Micah Zimmerman.
And I'm Paul Henderson.
Our diagnostic test, which is called Platin DX, predicts a patient's response to chemotherapy. This information is crucial for better decision making and treatment planning. Patients view chemotherapy as poison that is to be avoided unless absolutely necessary. Clinical trials of Platin DX are currently underway in the bladder, lung, and breast cancer settings in order to get an initial look at assay performance. Lean Launchpad forced us to focus on a single cancer application. We got out of the building and interviewed patients and physicians to better understand how the decision to proceed with cancer treatment is made in the real world. We found that patients, quote, panic upon the diagnosis of cancer and are often unable to make informed decisions, unquote. They usually follow the recommendation of the physician, and in the bladder cancer setting, we also discovered that surgeons predominate the management of treatment, not oncologists. Even though chemotherapy is accepted as standard of care, it's actually not part of standard of practice for many surgeons. They avoid it because they feel the low response rates, around 40%, the delay in surgery, as well as toxic side effects, are unacceptable. Key opinion leader oncologists made us aware of the overwhelming evidence that the survival of bladder cancer patients could be substantially increased if surgeons changed their current practice to include chemotherapy. In fact, a large fraction could be cured. Our assay could save lives. Big idea. This is a huge value proposition that was previously very much underappreciated by us. We are continuing to interview surgeons to identify assay performance requirements that would convince them to change their current practice. As shown here, we have developed a visual tool for surgeons that allows them to see the effect of assay performance on survival for these patients. Their feedback will be invaluable to the success of AMD.